Your liver could be in danger without you realizing it. 12 strange and unexpected warning signs you shouldn't ignore. Did you know that 1 in 4 people worldwide suffers from liver problems without even knowing it? What makes this even more concerning is that many consider themselves healthy just because they follow a balanced diet or exercise regularly. However, recent studies reveal that even those who seem healthy can develop severe liver damage without any obvious symptoms. According to the World Health Organization, WHO, liver diseases are among the leading causes of mortality globally, with millions of new cases diagnosed each year. Just last year, hospitalizations for liver problems among individuals under 40 increased by 40%, highlighting the urgent need to recognize early warning signs. This is especially important because many liver diseases are reversible if identified in their early stages. Here's the point. Your body could be crying out for help in the strangest ways. Have you ever noticed pale or floating stools, sudden swelling in one foot, or difficulty seeing well at night? These seemingly minor symptoms could indicate an underlying liver problem. In today's video, we'll examine 12 symptoms that might seem insignificant but could signal serious liver issues. Stay with us until the end. Symptom 12 is often overlooked but could save your life. What is the liver and why is it so important? Before diving into the symptoms, it's essential to understand the critical role of the liver. This extraordinary organ, the largest in the human body, weighs about 3 pounds, 1.5 kilograms, and performs over 500 vital functions, including detoxification. The liver filters the blood to remove toxins, drugs, and harmful chemicals. Metabolism. It converts nutrients from food into energy and stores essential vitamins and minerals. Bile production. Bile is crucial for digesting fats and absorbing fat-soluble vitamins. A, D, E, K. Blood clotting. The liver produces proteins essential for coagulation, preventing excessive bleeding. Blood sugar regulation. It maintains stable glucose levels in the blood. A healthy liver is indispensable for overall well-being. However, liver damage can occur gradually, often without showing noticeable signs until it's too late. Sign 1. Pale or floating stools. Not everyone pays attention, but the color and consistency of your stools can provide vital information about liver health. Pale, clay-colored stools or stools that float more frequently could indicate issues with bile production. Bile, produced by the liver and stored in the gallbladder, helps digest fats and gives stools their characteristic brown color. When bile flow is compromised, the body cannot properly absorb fats, causing fat buildup in the stool, steatorrhea. This could point to conditions such as intrahepatic cholestasis, reduced or blocked bile flow within the liver, gallstones, obstructions in the bile ducts, viral hepatitis, inflammation caused by hepatitis B or C viruses. If this change persists for more than 3 days, consult a doctor. Blood tests such as alkaline phosphatase, ALP, or bilirubin levels can help identify the cause. Sign 2. Spider veins. Spider veins, or spider angiomas, are small vascular lesions that appear as a central red dot with radiating blood vessels resembling spider legs. These signs may appear on the face, neck, chest, or arms and are closely associated with impaired liver function. Why do they form? When the liver is damaged, it fails to properly metabolize estrogen, leading to a hormonal imbalance that triggers the formation of these vascular lesions. What should you do? While spider veins are not dangerous in themselves, their presence, especially alongside other symptoms, could indicate advanced liver dysfunction. Consult a doctor for liver function tests, AST, ALT, bilirubin. Sign 3. Sudden weight changes. Unexplained weight gain or loss can be a sign of liver problems. The liver plays a crucial role in metabolism, protein synthesis, and fat regulation. Weight gain. Rapid, unexplained weight gain, particularly in the abdomen, is often due to fluid retention associated with ascites or peripheral edema. Weight loss. Sudden weight loss, on the other hand, could indicate severe protein deficiency caused by the liver's reduced ability to synthesize proteins. This can lead to sarcopenia or muscle loss, which typically affects the upper body first. When to worry. Studies show that unintentional weight changes exceeding 5% of body weight within 6 months warrant medical evaluation. Sign 4. Jaundice. Jaundice, or yellowing of the skin and eyes, is one of the most recognizable signs of liver dysfunction. This occurs when the liver fails to eliminate bilirubin, a yellow pigment produced during red blood cell breakdown, properly. Phases of jaundice. Yellowing starts in the sclera, whites of the eyes. It spreads to the skin, starting in areas with thinner skin like the face and chest. It may cause dark urine and pale stools. Jaundice can indicate conditions such as viral hepatitis, cirrhosis, bile duct obstructions, e.g. gallstones. Sign 5. Hepatic encephalopathy. Hepatic encephalopathy is a severe condition where the liver can no longer remove toxins from the blood, allowing them to reach the brain. One of the most problematic toxins is ammonia, which builds up when the liver is damaged. Common symptoms: mental confusion, difficulty concentrating or remembering simple information, personality changes, irritability, depression, or apathy, hand tremors, known as hysterexis, an involuntary flapping motion when the hands are extended, sleep disturbances, insomnia or excessive daytime sleepiness. This condition requires immediate medical care, as it can worsen rapidly. Sign 6. Pain in the upper right abdomen. Pain under the ribs on the right side is a common signal of liver dysfunction. This pain may be constant and dull, or sharp and intermittent, often radiating to the right shoulder or back. Possible causes: liver inflammation, caused by viral or alcoholic hepatitis. Gallstones. These can block the bile ducts and cause intense pain. Hepatomegaly. An enlarged liver can put pressure on surrounding organs. If the pain persists or worsens, it could indicate a serious problem like acute liver failure. It's crucial to consult a doctor for an accurate diagnosis. Sign 7. Ascites. Ascites is one of the most visible and dramatic signs of advanced liver problems. It involves the accumulation of fluid in the abdominal cavity, making the abdomen appear swollen or distended even without general weight gain. This isn't ordinary bloating. Acidic fluid can accumulate up to several liters, putting pressure on internal organs. What causes ascites? Portal hypertension. When blood flow through the liver is obstructed by scarring or inflammation, cirrhosis, pressure in the blood vessels increases, causing fluid to leak into the abdominal cavity. Low albumin levels. The liver produces fewer proteins necessary to keep fluids within blood vessels. Ascites not only causes discomfort, but can also lead to breathing difficulties due to pressure on the diaphragm, loss of appetite due to reduced space in the stomach, secondary infections such as spontaneous bacterial peritonitis. If you develop ascites, it is crucial to consult a doctor. Tests such as abdominal ultrasound and acidic fluid analysis can help determine the cause. Sign 8. Bleeding varices. Bleeding varices are one of the most severe complications of advanced liver disease, particularly cirrhosis. These dilated veins form in the esophagus or stomach due to portal hypertension, an increase in pressure within the liver's blood vessels. How do they form? When the liver is damaged, blood struggles to flow through it. Consequently, blood is diverted to smaller veins not designed to handle high pressure, leading to varices. These fragile veins can rupture easily, causing potentially life-threatening bleeding. Signs of a bleeding varix: vomiting bright red blood, hematemesis, black, Terry stools melena, dizziness or fainting due to blood loss. What to do? If you suspect a bleeding varix, seek immediate medical attention. Treatment options include variceal band ligation, an endoscopic procedure to seal the dilated veins, beta blocker medications to lower pressure in blood vessels, transjugular intrahepatic portosystemic shunt, TIPS, a procedure to reduce portal pressure. Bleeding varices have a 30% mortality rate during the first episode, underscoring the importance of early diagnosis and treatment. Sign 9. Asymmetrical swelling in the feet, especially the right foot. If your right foot is more swollen than your left, it could indicate that your liver needs help. This phenomenon, known as unilateral peripheral edema, occurs when the liver fails to produce enough albumin, a protein essential for fluid balance. Edema can result from conditions such as cirrhosis. Scarring of liver tissue replaces healthy tissue. Liver failure. The liver cannot perform its vital functions. A simple test involves pressing your finger into the swollen area. If an indentation remains for a few seconds, it is a clear sign of pitting edema. Sign 10. White or swollen nails. Terry's nails, characterized by a white nail bed with a reddish band near the tip, are a clear indicator of advanced liver disease. This occurs because the liver's ability to produce proteins is compromised, affecting blood circulation and nail health. Another sign is nail clubbing, where the fingertips become rounded and enlarged. This gradual change is associated with chronic liver conditions such as cirrhosis. What to do? If you notice these changes, it's important to get blood tests to assess liver function, including albumin and transaminase levels. Sign 11. Poor night vision. Night blindness or difficulty seeing in low light might seem like a vision problem, but it can be an early sign of liver disease. The liver is vital for metabolizing vitamin A, which is crucial for eye health. When the liver is compromised, it cannot convert vitamin A into retinol, the active form needed for night vision. Medical studies have shown that up to 60% of patients with chronic liver disease experience night vision issues. Don't underestimate these symptoms, especially if they occur alongside other signs of liver dysfunction. Sign 12. Yellow bumps around the eyes. These small deposits of fat, known as xanthelasma, often appear around the eyelids and may seem harmless. However, they are visible signs of a disrupted lipid metabolism, often linked to liver disease. Why do they appear? When the liver fails to properly metabolize fats, cholesterol levels increase in the blood, leading to lipid deposits under the skin. While they can also occur in people without liver issues, xanthelasma is more common in those with fatty liver disease, cholestasis, primary biliary cirrhosis. If you notice these signs, it's essential to check your lipid profile and liver function with blood tests. Strategies to protect your liver's health. A healthy liver is essential for overall well-being, but many factors, diet, lifestyle, and toxin exposure, can compromise its function. Here are practical strategies to support your liver. Replace harmful fats with healthy options. Avoid refined vegetable oils like soybean, corn, and canola oil, which can cause inflammation. Use alternatives like extra virgin olive oil, coconut oil, or grass-fed butter, which support bile production and reduce liver stress. Increase sulfur-rich foods. Foods like garlic, onions, and cruciferous vegetables, broccoli, cauliflower, cabbage, boost glutathione production, a powerful antioxidant that helps the liver eliminate toxins. Reduce sugar and refined carbohydrates. Excess sugar and refined carbs can lead to fatty liver disease. Opt for complex carbs like oats, quinoa, and whole grain bread. Drink green tea. Green tea is rich in catechins, antioxidants that protect liver cells and promote liver regeneration. Avoid alcohol and limit unnecessary medications. Alcohol is a leading cause of liver damage. Overuse of over-the-counter medications like acetaminophen can also overload the liver. When to see a doctor. If you notice one or more of these 12 signs, it's important not to ignore them. Early diagnosis can make a significant difference in treating liver diseases. Your doctor may recommend the following tests. Blood tests to check AST, ALT, bilirubin, albumin, and alkaline phosphatase levels. Liver ultrasound to detect abnormalities in the liver structure. Fibroscan to assess the degree of fibrosis or scarring in the liver. Liver biopsy in severe cases to determine the extent of damage. The liver is an incredibly resilient organ, but even it has its limits. With over 500 vital functions, we cannot afford to ignore the signs it sends us. The 12 signs discussed in this video should not be underestimated, as they may indicate serious problems that, if diagnosed early, can be successfully treated. Thank you for watching. If you found this content helpful, leave us a like, subscribe to the channel, and share the video with someone who might benefit. Prevention is the key to a long and healthy life. Don't forget to watch the recommended videos for more health tips. Take care of your liver. Take care of your life. Disclaimer: the information provided is for informational purposes only and is not a substitute for medical advice. For diagnoses, treatments, or changes to your diet or lifestyle, always consult a doctor or qualified specialist. Each symptom may have different causes. Rely on a professional for personalized assessments.